So here we are to talk about nasal reconstruction following previous rhinoplasty or trauma. Rhinoplasty, or otherwise known as a nose job, over the years has been really a fashion statement. Back in the 60s, we made these little tiny noses and everybody wanted that tiny nose. Now, the trend is really to make a nose that looks natural and not done, but better. And that's extremely important, but there's all these patients that have had previous nasal surgery and they have these tiny noses, and back in the 60s, doctor would say, I'm going to give you a really cute little nose, just like in the magazines, but you're not going to be able to breathe. And patients said, no problem, I don't care about breathing. And now they care about breathing. And we now realize that breathing is really, really important. So therefore, we're taking these noses that were previously done, and at the time, previously done properly, but as a result, resulted in nasal obstruction and worsening of people's breathing. And now what we do is we assess why those patients are having problems with their breathing. And what we do is go in and we reconstruct those areas. Now we have the septum, which is the middle part of the nose, and sometimes that needs to be straightened. 2 is the nasal valve, which is the temp to your nose. And a lot of times that's pinched. And if you just pinch the tip of your nose, you'll see that just pinching it a little bit will cause you a maximum amount of nasal obstruction. And in many patients that have had previous surgery and or trauma, that area is pinched in, and as a result, they have a nasal obstruction, which now needs to be corrected. And we do that various ways with grafting. We can do that by opening it up and recontouring the cartilage and the bone of the nose to make the nose more functional. Having a functional nose that looks good is very important. And having a nose that looks good that's not functional is really something that's going to come back to plague the patient. One, it causes snoring and sleep apnea, it causes difficulty breathing through your nose and discomfort. And it may cause, because the fact that there's no air going through your nose and sinuses, difficulty with your sinuses. Therefore, it's extremely important, if you're having problems breathing, to be seen by somebody that's a nasal and sinus specialist who can put all the pieces together and figure out what in your nose and in your sinuses is causing a blockage of your breathing so that you can breathe easier, feel better, sleep better, and have more restful sleep so that when you're awake, you can function at a higher level. Thank you.